to the podium Dr. Charles Dessau, who's going to share his tips and tricks on volumetric approach to facial lipotransfer. Dr. Dessau.
Good morning. It's a great honor to be here. I would like to thank the American Society Board for the invitation. Today we talk about volumetric approach to facial lipotransfer. Now I have a new concept, a new frontier about regenerative facelift. The goal of the lipotransfer is to lower the absorption index and increase the retention index. It's very important to consider some steps such as harvest area, harvest metal, processing, bioactivation, transfer metal, and recipient side. How to collect the deposit tissue for facial lipotransfer? We published our clinical trial about influence of negative pressure on the viability of adipocyte and mesenchymal stem cell, considering the device method used, syringe and suction machine, to harvest fat tissue in 8 different pressure regimes. We collect the deposit tissue from cervical and abdominal area, use a blunt tip 3 mm cannula, contain 3 distal rollers connecting a 2 cc syringe. For the donor area, we use the tumescent solution. Our protocol to facial lipotransfer has been the mechanical SVF enriched fat tissue. We collect the pellet after centrifugation and mix it a washed lipoaspirate tissue to prepare a cell-enriched tissue. To transfer deposit tissue, we adopt the Coleman protocol. This is a very interesting paper published by Conde Green and Natalie Montijo. They analyzed 3 processing methods of lipoaspirate and compared the effects on the adipocyte and mesenchymal stem cell in each sample. The histological analysis demonstrating the candidate sample more viable adipocyte and more blood-derived cells, and washed sample has more viable adipocyte and great number of mesenchymal stem cell. And centrifugation by Coleman protocol has the 4-layer containing the pellet and cells of the SVF. The analysis of data showed more adipocyte in the candidate sample and more adipose-derived stem cell in the pellet. On the other hand, in the candidate sample contain more red cells. We took the best part of them to prepare the mechanical enriched SVF tissue. In the second study, we analyzed the numbers, the mesenchymal stem cell in the pellet of 23 patients. The results show an amount close to 14,000 cells in each pellet. The mechanical SVF cow was prepared by adding the pellet containing cells of the SVF to a 10 milliliters the lipoaspirate tissue to prepare a cell-enriched sample. This sample represents a similar adipose-derived stem cell ratio of the intact adipose tissue. This is a clinical trial published in 2017, a comparative clinical trial between a mechanical SVF enriched fat graft with a standard lipotransfer. The enriched group presents a longer absorption index than the standard group. The SVF can be obtained by mechanical dissociation after centrifugation. Based on our clinical observation and our clinical result, we have used the mechanical cell-assisted lipotransfer to volumize replacement of face. In this case, one section of the mechanical cell-assisted lipotransfer was used in the patient with Paris-Rombe syndrome. The image scan shows a similar tissue features between both facial sides. To volumize the face, we have used lipotransfer in multiple areas on different planes and layers. To determine the volume replacement, we can use a clinical analysis or software, and you can use such as a Palmer measurement by Roger Curry, the facial contralateral comparing analysis, and CT scan, and image 3D device as vector. Now I have emerged a new concept about the approach of structural change of face, the three-dimensional lifting. To approach pitosis tissue area, we have used a tissue elevation by application. To approach of volumetric loss area, we use a volume replacement using a cell-assisted lipotransfer. The surgical planning depends on the volumetric aspect of face. For full face, the treatment requires the mastectomy and mass elevation. For a thin face, the treatment requires the application of mass and lipotransfer. In case with facial volume asymmetry, we have considered a different approach of ham face. After our facelifting, we just lipotransfer just one side for reach the balance between both facial sides. And 1 year post-surgery, we have more balance, volumetric balance between both facial sides in this patient. In case with previous facelift, we restore the volumetric aspect of face, use a full face lipotransfer. In this case, just one section, 2 years post-treatment, restore your fat compartment of face. Another case, in the last case, use just lipotransfer. This patient, who is 55 years old, presents a cervical facial flaccidity and volume loss. He was submitted a facelift and associated a lipotransfer, mechanical lipotransfer, to restore a fat compartment of face. 1 year post-surgery, we restore your volume proportional of face, just one section of the lipotransfer associated a facelifting. Another case, presenting a facial flaccidity associated a volume loss. The treatment addressed the vertical application of mass and malar fat pad and lipotransfer. The lipotransfer was used after vertical application of mass and malar fat pad and subcutaneous area and submass plane. 1 year post-treatment, she presents more history volumetric proportional of face and more fuller appearance. In order to transfer the deposit tissue, it's very important to consider the volumized aspect given by adipocyte and regenerative aspect given by adipose-derived stem cell. Based on our clinical observation, we have noticed patients submit a facial lipotransfer, an improvement of volumetric aspect of face and increase of skin quality. Deposit tissue seems to be not only a simple filler, but a dynamic filler with two different supplementary effects, the volumetric effect and the regenerative effect. Based on our clinical observation, we published our clinical trial about anti-age treatment of facial skin by fat graft and adipose-derived stem cell. Its paper was considered the best international paper by PIS June in 2015. And now I have just a short video for our practicing about lipotransfer associated facelifting. I have a sound. Okay, now the future is here with multipotent cells. Thank you for your attention.